Hello, my name's Paxton. I make videos on testosterone and how it affects people. In today's video, we're going to talk about overdosing and just general risks of taking testosterone. Yeah, we'll get into it. I just realized I forgot something, but it's not that important, so we're just going to push through. So I have my computer with my handy dandy notes. So, I'm going to start the video just by saying a little disclaimer. There's really not a lot of research available on trans people taking testosterone. There's really not very much at all. So most of the research I did was on anabolic androgenic steroids, which is testosterone. It is. But in this sense, it's the type of testosterone, not the type of testosterone, but the use in which it's for like athletes and people who are trying to get better performances, or bodybuilders who want like better looks, things like that. So it's still testosterone. It's the same type of testosterone you would take as a trans person prescribed by a doctor. It's just used for a different purpose. It's still kind of generally the same themes, but that does also mean most of this research is on cis men. But because of how like the things we're talking about aren't specific to like sex organs or hormones, it's not really that big of a difference, just because like organs in a cis man and a cis woman are the same, essentially, mostly, generally. Like, they're gonna have the same livers. Do you know what I mean? So if there's a liver issue from taking testosterone, it'll happen in this, because they have pretty much the same liver, it'll happen in the same liver. Do you know what I mean? That was kind of confusing. Yeah. I'm not going to be talking about behavioral health changes, because that is a big thing, especially with overdosing. But I've already planned for that to kind of be its own video. And also I talked about it a little bit already in the symptoms video. Also, just this video isn't meant to scare anyone, because when you're taking testosterone as a trans person, you kind of are just overdosing. The levels at which a cis woman would have, but you're not a cis woman. So, you know, that's just how it is. But this makes overdose is a really big risk, because especially with something like testosterone, where the you get really desired outcomes from it. Like you get more muscle tone, a little bit of weight loss, improved performance, allegedly. It's a desired outcome that people think that, oh, if I take more, I'll do better, I'll look better, even though they could be damaging them a lot internally. So that's why it's a big risk that you want to be really careful about. Most of the risks that I'm gonna mention are kind of rare. I mean, they'll only really happen if you're like overdosing a lot, and you're doing it unsafely. If you're not doing it as your doctor's instructed you to do it, then you're at higher risk for more complications. It also has a lot to do with genetics. If you have family members who have some of these conditions and you start taking testosterone, you may be more likely to get them. So it's very important to know your family's medical history. Okay, one more thing before we get started. In my last video, I did a video on symptoms of testosterone, but I didn't talk about specific organs, because I mentioned that they were pretty much the same. Just like imagine the organ function of a cis man, and that would kind of be what it becomes. This is true. It's just not very. It's not a good explanation. It's not very helpful. So I thought I'd do a little more of a physiological, what's happening to you thing. So we're gonna use the liver. as an example. I'm just loving the liver examples today. So the liver secretes hormones that break down food in the small intestine. This is why I had a bunch of drawings of different body systems that would have been kind of helpful right now, but it's okay. I'll put a picture on the screen of kind of what's happening. So the liver secretes hormones that break down food in the small intestine. So your small intestine is the small intestine, and that's where your food travels, and the nutrients get absorbed into your body through that. But the liver secretes hormones that breaks down the foods that it's small enough to get absorbed. Taking testosterone, it sends signals to the liver that tell the liver to increase the secretion of these hormones. So this makes your food digest faster, which is why cis men have not cis men. People with more testosterone, they digest food faster. They have faster metabolisms, because it's your testosterone is telling your liver to secrete more hormones to digest faster. So 2 sections of this video: risks at regular dosage and risks at overdosing. Yeah. So it's gonna be pretty similar to the symptoms video where I just kind of list a lot of things. Especially towards the end where I just start listing conditions, but I'll try to be really kind of analytical of it all. So testosterone leads to increased red blood cell production, which can lead to hyperviscosity of the blood. That is dangerous because your blood sends nutrients, especially like oxygen, to your whole body. So if your blood is really thick, that movement of nutrients is slowed down, and that could be really damaging to a lot of your whole body, really. It also makes you more susceptible to a stroke or a heart attack. Most things honestly make you more susceptible to a stroke or a heart attack. It's just because with a stroke is when part of your brain stops receiving blood, usually from like a blood clot, and so that brain just dies because there's no blood going to it. And we all know what a heart attack is. Yeah. So this is treatable with either withholding or slowing down treatment, or just taking out some blood. This happens with some other conditions where you just have too much blood or really thick blood, and so you'll just like go to a doctor every once in a while and they'll take out some blood just to help keep things moving. Yeah. So there are dramatic changes to your lipid metabolism, which I was talking about earlier with the liver, which is basically your body's process of breaking down and storing fat cells for energy. Most of your issues come from the change in your metabolism, just because it affects your whole body, because it's your energy storage and how your body's using energy, which is what kind of keeps you going. So the negative effects of this change in your metabolism is increased levels of low density lipoproteins / cholesterol. I'll just call them proteins, or low density lipid protein, whatever. It's really a tongue twister. You'll understand what I'm talking about. And decreased level of high density lipoproteins / cholesterol. So these aren't cholesterol. You know, cholesterol, people who have high cholesterol have, they're more at risk for like a heart attack, stuff like that. Low density we're gonna go through this together. Low density cholesterol is also known as the bad cholesterol because it carries fats through the bloodstream. This is crucial and very important to your body, but too much of it can cause plaque buildup in your blood cells, which can lead to heart problems later on, specifically atherosclerosis, which is when there's too much plaque buildup and your blood can't blood is kind of blocked up. And high density lipoproteins is what's called the good cholesterol, where because it gets rid of the extra cholesterol left behind in the bloodstream by the low density cholesterol. So it's what happens is with an increase of the bad and a decrease of the good, it just means that there's more likelihood for plaque buildup. This also has some genetic factors, especially if a lot of people in your family have high cholesterol, you're more likely to have high cholesterol. Yeah. So there's a lot of disagreement on whether testosterone increases the risk of stroke and heart attacks. From the studies I've looked at, there is definitely some research that suggests that this is not true, and that the risk of cardiac diseases could actually be increased. Especially as I talked about earlier with the hyperviscosity of the blood that could lead to stuff like that. Stroke and heart attacks are just a side effect of so many things that it's impossible to not have it be an issue, honestly. But yeah, some research suggests that the risk of cardiac disease is increased threefold, which just means you're 3 times more likely to have cardiac disease, than someone who's not taking testosterone. So a lot of diseases are more common in men than women. So when you start taking testosterone, you're more likely to get it. But again, and I cannot stress this enough, it's all about genetics. It's genetics all day. So one of these specifically is diabetes, specifically type 2 diabetes, because type 1 diabetes is you're born with it. Type 2 you get later on in life. This has to do with changes in your metabolism, your lipid metabolism, as I talked about earlier, and how your glucose tolerance can be lowered, as well as there being an increase in insulin resistance. So type 2 diabetes, if I'm not mistaken, I always get type 1 and type 2 mixed up. If I'm not mistaken, here, let me actually, I don't want to spread misinformation. Right, okay. So type 1 diabetes, your body cannot produce insulin, but in type 2 diabetes, your body's insulin receptors just stop working. They just decide they're done for the day and they don't want to work anymore. Yeah. There's lots of ways to manage diabetes. It's a very common, especially in the US, it's a very common condition. There's lots of ways to manage it. So with so when it comes to periods, as I talked about in the symptoms video, your periods will stop if you take high enough doses. If you don't want it to stop, there is ways to do that with dosaging. But there is risk of spotting and discoloration of period blood from the hormone imbalance, as well as changes in metabolism. This isn't necessarily a risk or a bad thing, but it is really something to be aware of, because it can be quite scary if maybe you haven't had a period for 2 or 3 months, and then all of a sudden you see some spotting and it's like purple, that is really scary. So in that instance, it is recommended you go to a doctor, but also if you know what's happening and you understand, like, okay, I am taking testosterone, I am experiencing hormone imbalance, this is a sign of that, then, maybe you don't have to go to the doctor. But you should let your doctor know. But, this isn't going to kill you, most likely. If you know it's from your testosterone and not from other health factors, then, yeah. There's an increased risk of coronary artery... It's just tongue twisters all day long. There's an increased risk of coronary artery disease / a coronary artery thrombus formation. A thrombus is a blood clot. And your coronary artery is... around your heart, there are blood vessels, And these are important because it's your heart is what keeps you alive. If your heart stops pumping, you stop living. And every cell in your body needs to be attached to like a blood vessel. Like it has to have blood coming to it to be alive. Otherwise, your cells will die. And so your heart really needs that. And so there's special arteries and vessels that are attached to your heart that are called coronary. So an artery, by the way, just a little heart lesson. There's two types of like, not vessels, but yeah. So there's an artery and a vessel. An artery takes what's been pumped through the heart out and gives it to the body. Ventricle. Not ventricle. A vessel. A vessel takes blood from the body and pumps it through the heart. So, yeah. I think it's called a vessel. I may be mistaken because that feels wrong. But anyways. So, when there's a blood clot in your coronary artery, that's a big issue because the things around your heart are really important to keep your heart pumping, and if there's a blockage in that, then your heart can't get blood, which means that your heart will die. Again, genetics. So a little more anatomy of the heart. There's a left ventricle and a right ventricle. The right ventricle pumps directly to the lungs, and the left ventricle pumps to the rest of the body. So the left ventricle is bigger than the right ventricle because it has to pump harder, because the heart is right next to the lungs. The right ventricle just doesn't have to do that much work, while the left ventricle is pumping a lot more blood a lot farther. So it has to put in a bit more work. So it's a bit bigger. When taking testosterone, there's risk of the left ventricular wall, which is the left ventricular wall hypertrophying, which hypertrophy is when something gets bigger, atrophy is when something gets smaller. It's usually used in the context of muscle. If you use muscles a lot, they'll get bigger, which is hypertrophy. If you don't use them, they'll get smaller, which is atrophy. So when there's risk of the left ventricular wall hypertrophying as well as the septum. The septum is what's in between the right and the left ventricle, and it's what separates them. And this is more than would be expected for like a regular resistance training, because if you work out a lot, your heart is going to be bigger because it's pumping more blood. If you just kind of sit around all day, your heart might be a little bit smaller because your heart doesn't have to pump very much blood. So because the walls around your ventricle are thicker, it means there's less room inside, which can lead to issues later on with just not being able to pump enough blood. The biggest risk, and when I say biggest, I don't mean like most dangerous, I just mean most common, is injection site reactions. This is mostly because of risks of, at least in when not prescribed or when not done as doctors tell you to, the biggest risk or the biggest issue is risks of contamination and self-taught techniques that can be really damaging. But if you listen to your doctor and do it as it's told, there's less issues. However, even then there is risks of abscesses, which are just kind of like pimply infection kind of in the injection site, as well as sepsis, which is another form of infection, which is really dangerous. But if you do it correctly and cleanly as your doctor tells you to, this really should not be much of an issue. There is also, with injection site stuff, it's also just your body doesn't love when you stick things in it, as well as, like if you do it at a wrong angle or if you hit a blood vessel, that's not a problem. It just means that that blood vessel has to heal, which can lead to some swelling and bruising as well if it bursts. As well as, what was I gonna say? There was something else. This is a little off topic. I've been doing some research into whether you need to keep testosterone refrigerated, because doctors tell you do, and you do for preservation. I don't know if that's the right word. To preserve it for longer. However, when you put it into your body, you actually want it to be kind of room temperature. And so if you have it as the temperature of your fridge, it can cause issues in your body where it tries to, like, just because it's too cold. I don't know exactly. I haven't done that much research into it. But you can understand where an issue would arise there. Okay, now this is the list of medical diseases and conditions. Bear with me. We have cardiac toxicity, which is just, I don't know, TBH. It just issues with the heart. Hepatotoxicity, including hepatic adenoma, and hepatocellular carcinoma, which hepatic means kind of the liver gallbladder area. So just lipid abnormalities, as I talked about earlier with the cholesterol. Gynecomastia, which is increased breast tissue. Actually, 1 second. Okay, yeah, sorry. I was just making sure I wrote something down. Increased breast tissue. This happens for a myriad of reasons, gynecomastia, but I'll talk about it in a second. Gonadal hypertrophy, which is hypertrophy of the gonads, which is your sex organs. Specifically, in cis women, it would be, or in people born as female, it would be the ovaries. In people born as male, it would be the balls. Okay, and we're back. So I did just look back at the footage, and I saw it, and I was like, oh, I'm ghastly. The lighting is so horrible because it's just white out, and I'm in my car, and you can't really. Actually, that's not bad. But I'm not gonna refilm that, and so I'm sorry that it looks rough. We're just gonna have to push through. I'm sorry to say, that's just how it is. Anyways, on with it, because we're barely halfway through. As I was saying, there is risk of infertility, which I'll talk about in another video, as well as psychological abnormalities, which I'll talk about in another video, and immunologic depression. This just means testosterone, there have been studies that show it weakens the immune system. Especially, I know a lot of people are like, oh, my, like, dad, whenever he's sick, it's like it's the end of the world. It's just because he has a worse immune system. So, and then some medical conditions can be worsened by testosterone if you already have them. This can also, you're more likely to get them as well, especially if genetics, Okay, so thromboembolic disease, which is okay. So with a blood clot is a thrombus. This will block up blood flow. However, things can happen to a thrombus where an embolus can break off and travel somewhere else in the bloodstream, or travel through the bloodstream elsewhere. So this is thromboembolic disease. Macroprolactinoma. I should have looked up what that meant. I assume it means, I'm relatively certain actually, it means lactation. I'll look that up for you. It is a large benign pituitary tumor that excessively secretes the hormone prolactin, which causes symptoms of hormonal imbalance. So your pituitary gland is a gland in your brain that secretes hormones, like sex hormones, and if there's a tumor there, it can lead to excess of a hormone, in this case, excess prolactin, which I think could lead to lactation. But, no, that's my bad. Anyways, severe liver disease, coronary artery disease, as I mentioned before, severe migraines. There is, okay. Some studies say that there's an increased risk of breast or uterine cancer. Some say it doesn't increase the risk at all. So, kind of 50-50 on that one. Cerebrovascular disease. Cerebrovascular means like brain area. Because I looked up the rest of these things on this list except for these like 6 things. So I know what they all mean, except for these ones. Because cerebro, I forget what vascular means. A group of conditions that affect blood flow and blood vessels to the brain. Yeah. That's what I thought. I had to double check. And then erythrocytosis, which is just increased red blood cell production, which can lead to a lot of issues. Okay, a few more. I think these were all mentioned in the symptoms video, but just going over again in case you haven't watched that really quick. Weight gain, acne, sleep apnea, which is issues with sleeping. I can't go into it right now. Male pattern baldness, high blood pressure, infertility, drying/thinning of the lining of the vagina, pelvic pain, just because, especially if your pelvic bones haven't fully formed, the testosterone will kind of make it change shape a little bit, just because it's actually really interesting. People born as male don't need a pelvis necessarily. That's not true. They I forget exactly. Their pelvises are smaller because they don't need to make a baby, but they need it to still be the same species, men and women, which is really interesting actually. But your pelvis area may get smaller. Discomfort in clitoris, it changes shape. Increased risk of cancers we're not sure about. Now we have the risk of overdosing. So, there's a natural process in the body called aromatization. In terms of testosterone, this manifests in testosterone being turned into estrogen to maintain hormone balance. So, this happens to everyone. People not taking testosterone as well, your body will take extra testosterone or not extra, it'll just, I don't know exactly how it works. We'll take testosterone and turn it into estrogen. However, when overdosing, when T levels are that high, the body tries to synthesize more estrogen, just take out more testosterone, and this is why this doesn't have that many issues on its own, but this is what leads to the gynecomastia and bigger breast tissue. Abuse. When I say abuse, I mean abuse of testosterone, which means using too much. Abuse is associated with aggressive/manic behavior. I will talk about this later in another video. We'll touch on that. There is risk of tissue damage and specifically lower usage from the left ventricle of the heart, likely because of increased wall tissue. I talked about this earlier in the video with hypertrophy of the septum and left ventricular wall. High doses can support hypertrophy of sebaceous glands and increase sebum/skin surface lipids. That just means like oils on the skin. You got a lot of oils on your skin. Hypertrophy of sebaceous glands, it means they get bigger, they secrete more skin surface lipids. Okay. Now, the rest of it is just listing conditions. A lot of this is, I explained these a lot more. Okay. Pre-existing skin conditions may worsen. So I'm going to list a bunch that you could get or could get worse. Acne, seborrhea, which is itchy rashes and kind of white flaky skin on kind of scaly as well on top of it. By the way, you're welcome to search any of these up. I implore you to do that with caution, because some of these things are a little scary to look at. Not scary to look at, but just a little. Well, that's not ideal. Strine distensae, which is just stretch marks, but more specifically dermal scarring when skin grows or shrinks rapidly. Testosterone can give you rapid changes to your body, physically, shape. Sorry, it's really bright out. My glasses are like making it hard to see the rest of the world, but I could like see this, but not everything else. What was I talking about? Right, especially as we talked about earlier with the liver and the faster metabolism of fat cells into energy. It means that you're probably losing, maybe not a lot of weight, but you're definitely losing weight. And it can be lost quite rapidly depending on dosaging and genetics and just who you are, which can cause stretch marks. Hypertrichosis, which is an abnormal amount of hair not related to androgens. So androgen just means testosterone. Testosterone is a type of androgen. When you take testosterone, you grow hair all over your body. Your hair just grows faster, especially facial hair. This is hair that's not related to that. This is an abnormality where you'll have kind of hair or what is it called? Like head hair type hair all over your body or in patches on your body. This is usually presented at birth, but it can be acquired later in life from other drug side effects as well. Hirsutism, which happens in people born as female. It's when it just means growing facial hair in the pattern of a cis male, which just kind of means beard. Anyways, rosacea, which is just long-term redness in the face. Folliculitis, which is when hair follicles can become inflamed or infected. The hair follicle is the hole in which your hair grows out of. So if it's inflamed or infected, it can cause some issues with their hair. Keloids are a type of enlarged scar it means that you heal differently. This happens when the body produces too much collagen. It's actually somewhat common. It's also something you can be born with. And furunculosis, which goes back with folliculitis. It's boils that can appear with infected hair follicles. Okay. Continue on. Now we're on to kidney issues. Okay. Now, these are just specific to like these regions. Like, we're doing specifically the skin, kidney, and oral regions, but obviously there can be issues with other parts. But these are kind of like your largest organs, most problematic areas. And I already talked about the heart issues a little bit. Okay. So, kidney stones. This is calcium buildup in the kidneys that can lead to these little balls that go through your intestines. These are extremely painful. I've never had one. But some people do say it's like more painful than childbirth. And these are people who like have had a child and say that kidney stones are worse than childbirth. They are more common in men, but can happen in women. So, yeah, it's really painful. Then we have stasis, not too sure. The flow of bile from the liver stops. I forget exactly what bile does. I think it's important for your microbiomes or something. I forget exactly. I'm sorry. I think it breaks down stuff. I was zoning out during that unit a lot in physio. But it's important, you know. Anyways, tubular necrosis. This is when the tiny tubes in the kidneys don't work. Your kidneys are very important. You don't need both of them to function, but you do need one. At least one to function. And so if they don't work, it can cause a lot of issues. Hyperbilirubinemia. This, I think, is another one that's often seen at birth. This is when excess bilirubin builds up in the blood, causing jaundice. I think this has something to do with the liver again, in bile. I'm not too certain on that. I'm so sorry. Then we have proteinuria. I don't know. This is just excess of proteins in the urine. It means that your body's it could be bad because it could be a sign that your body is taking out too many proteins that you need. So that could be an issue. Renal cell cancer. Renal cell just means kidney, so you could have cancer in your kidneys. And Wilms tumor, which is specifically a kidney cancer. Okay, almost done. There is possible issues with the gums. You can have gingival tissue enlargement and encroachment. Gingival means the gums, like gingivitis, the gums. Enlargement means that they grow bigger, and encroachment means that they kind of swallow your teeth a little bit, like they just, yeah. So that was really specific and really helpful. In this case, overdosing is not necessarily life-threatening. Like if you overdose opioids or something like that, you could die. If you overdose testosterone, unless you take so much of it, you probably won't die. But it can cause long-lasting damage, cancers, things like that. That can be irreversible, so it's really important to keep that in mind. I said this at the beginning of the video, I'll say it again. It's important to keep in mind that essentially, as a trans person, you are overdosing testosterone. Because you are taking more than what your body can handle, but you're doing this for a reason and for a purpose, and that is to feel better as yourself and feel like you're representing yourself in a way that makes you feel comfortable. And so it can be very dangerous, but at the same time it can make your life so much easier that it really is worth it. But it's very important to keep in close contact with your doctor. Do as they tell you. Obviously not without reason, just be cautious. Make sure you're doing things that make you feel comfortable, and just be really safe with it as well. This A lot of these issues have to do with the type of testosterone you're taking. Again, a lot of this research was done on athletes, people who don't want to go through a doctor to get prescribed testosterone, so they may take stuff that they may buy off the black market, or from foreign countries that have different health regulations than the U.S. does, or wherever you live. So it's just important to keep that in mind as well. There are probably hundreds of types of testosterone on the market, but the ones that your doctor will prescribe you are going to be the safer ones that have been tested a bunch. And if you want to know more about that, I did make a video on different types of testosterone. It kind of went into 5 main ones, 3 categories, where it's patch, gel, and shot, and then for the shots, different types of serums that they use. I will mention as well, most of these are shot specific. I'd say, yeah. The shot is very invasive, and that's why it can cause so many issues. It's also at a much higher dosage than the gel or the patch are at. But if you're taking the gel or the patch for a long time, you are still several of these issues. It's just it may take longer to appear because they're at lower dosages. But also less risk of overdosing with the patch or the gel. So if you're worried about behavioral issues that could lead to overdosing, then just talk to your doctors. Really, at the end of the day, it's always a few things. It's talk to your doctor, listen to your doctor, genetics. That's really what it is at the end of the day. Yeah, so we're done. I'm hot. I hope my face isn't too red. I'll take my glasses off. Some guy that just parked next to me is now wandering around. My camera's gonna turn off soon, so I'm just gonna keep talking until it does. I've got 4 minutes, I think. Yeah. Well, yeah. I'm sorry I didn't film a video last month. I was really busy. I had AP tests, I had finals. And this one, I did way more research than I needed to. And it just kind of made things take longer. I think the next video I'm doing is going to be on infertility. And then I think we'll probably get to behavioral issues after that. I think I also have another one planned on specifically face changes. I think that may also be a part of the behavioral one, like the face and the brain. I think I want to do specifically, but I don't know if I'm going to do that separate. I don't know. We'll see. Yeah. So I hope you have a really great day, whatever you're doing. Happy Pride Month. It's June right now. I don't know if this is going to come out in June. I sure hope so. I'm going to be away. I'm going to be out of town for all of July. So I'm going to try and film a video. I don't know if I'll be able to. But I'm really going to try. I'll try to do most of my research before I leave. But we'll see. Okay. I hope you have a great day.